What's going on, everybody? John Stamper here with DentalCast Productions, day 2 of Dentrix BDC 2019, organized by Henry Schein 1. We got a great day ahead for everybody, and what we're going to continue to do today and tomorrow is we certainly wanted to take some time to talk to some of the great industry experts that are here on topics that we know that everybody is thinking about. And so very excited to start this morning with Doug Sligting, who is the CEO of Ascent. How you doing, Doug?
I'm doing great, John. Thanks. Glad to be here.
Absolutely. Thanks for coming on. So I know we're going to talk a little marketing, right?
Mm-hmm.
We're going to talk a little marketing. You know a little bit about that, as we've heard. And the first question that I have as we get into this is, what is practice marketing? I know a lot of dentists are thinking about it. There's all kinds of things about how they market their practice. But when I ask you that question, what is practice marketing? How do you think about that?
So marketing fundamentally is an attempt to control perceptions in order to influence actions. Okay, so marketing is the process of influencing those perceptions. When you bring that specifically to a practice, you can kind of think of it as almost every point of interaction between the practice and potential patients and current patients that are going to influence how they think about you.
Right.
Which really is pretty much everything, right?
Right.
So almost everything you do within a practice that influences patients is marketing.
Right. Which is interesting you say that, because I think a lot of times, as you know, Doug, people will tend to look at specific actions, and it could be a trap, right? They're not thinking about some of those ancillary things that could be the difference between attracting the patients or not.
Right, and especially when you understand that the perceptions a person has of your practice will always determine the actions they take in accordance with it, right?
Right.
And that's both prior to becoming a patient, so that dictates what type of patient you're going to get. And also, once they're a patient, it determines whether they accept treatment plans, reappoint, refer people. I mean, every decision they make in regards to your practice really comes down to how you market to them throughout that patient experience.
And it's interesting because it seems like, I tell people this all the time, dentistry has always been this reactive profession, where fortunately for a lot of dental practices over the years, a patient was in pain, they came in. And so practice owners, as you know, didn't always have to go out there per se or market their practice, market themselves. So talk a little bit now, why is it so important now for dental practices?
Well, things have changed. It's probably about 15, 20 years ago, the PPO explosion. I guess explosion is maybe the wrong word, but basically over the last 15, 20 years, PPOs have really taken over the marketing process in a dental practice. And keep in mind, PPOs and insurance is nothing more than marketing.
Sure.
I don't know a practice that does it for any other reason to bring patients in, right? Well, even though it might have been effective initially, it's become a pretty ineffective way to actually market a practice. But more importantly, what's happened is now most practices are writing off 30% of their total revenue because of insurance marketing primarily.
Right.
And so it's created a situation where basically you've taken 30% off the top of a dental practice, you need more revenue.
Right.
And so marketing has become more and more important over the years for practices to try to figure out, well, how do we bring additional patients in, but even more importantly, how do we bring more revenue into the practice? And really marketing's responsible for that as well.
Right. Well, and you brought up something interesting that I don't know how often people think about this. There is so much that is done before that patient ever sits in the chair or the skills of the dentist, right? I think a lot of times there's so much training and continuing education on the clinical skills and how to do a proper crown and implants and all these things. But as you know so well, if you can't get them into that chair, or what you do at the front, or like what you even do before they even get in there and the perception that they have before you even get a chance to showcase your skills.
Well, and so the thing you have to remember too is most patients don't really understand the skill set of a dentist too well anyway.
Right.
What they're purchasing is actually the perceived relationship and the perceived experience of that practice. Now, this is someone obviously who values dentistry. People who don't value dentistry, they're just buying offers. Right. They just come in when there's pain or whatever. But if I value dentistry, what I'm actually going to purchase is the relationship. And so when you talk about marketing your practice, it's how do you sell those experiences and those relationships to patients. The skills they take for granted.
Right.
It's unfortunate, but it's just the way it is.
Yeah.
And so what you focus on in your marketing is how do you sell that relationship.
Sure. All right, so the practice realizes the importance of it, knows they need to move down that step. what do you typically advise when they want to get started? What's the best way to start getting down that path of really building this into the practice?
Well, the first step really is to understand where you're currently at. Not all starting points are equal. You know, right? You could have two dentists just down the street from each other, both start the exact same marketing processes, but they're obviously going to generate different results, right?
Right.
It's because their starting points aren't equal. There's a lot of factors that determine how well your marketing works. And my first recommendation would be to understand, well, where are we at?
Right.
You know, what's going on internally, for example? Do we answer the phones correctly? Are our teams trained on how to ask for referrals and do case presentation, et cetera? You know, how much brand equity have you built in your community? Have you been doing any marketing in the past? And more importantly, how competitive is your online area? You know, are there a lot of doctors vying for those same keywords and same ad space and so forth? Because all those things are going to affect how well your marketing is going to work. So the first thing you need to do is get an analysis of where you're at from a competitive standpoint in all those different areas throughout your practice.
Yeah. And are you seeing, I know you're presenting here a couple of times at this conference.
Yes.
And it's encouraging to see that more and more practice owners are taking this seriously. I'm sure you
Yeah.
see that and get all kinds of questions, I would imagine.
Right. Yeah, you know, it's funny. I've been lecturing about dental marketing for almost a decade now, and it used to be really difficult to get people to come to a marketing seminar if you're in the dental industry. And now it's getting pretty easy, and it is encouraging. And I think that the bad name marketing used to have in the industry has really been shed for the most part.
Yes.
And I think most practices realize now, hey, this is just something we've got to figure out. It's really the responsibility of the business owner to figure out how to build the business.
Yeah. Well, Doug, thank you so much. I know
thanks,
the
John.
Henry Schein One team and the Dentrix team surely appreciate you here, your insight being at this event, and it was a pleasure speaking with you.
Yeah, it's been great. Thank you very
All right,
much.
You got it. Yep.